According to the World Health Organization, three-quarters of people living with epilepsy in low and middle-income countries, including Nigeria, do not have access to the treatment or health care that they need. How true is this, and what is the way forward?
Actually, the area of challenge. Like personally, because of that challenge, I decided to possibly with colleagues and friends form the epilepsy ambassador. Like looking at what happens in our environment. Some of the patients will come around, you see them, okay, go and get your drugs. They don't have the money to actually purchase the drug. Some of them cannot even pay for the test. You see some of them come around, they have the option of either paying for the test or buying the drug. So you just tell them, you know what, the drug we actually treat. Possibly you go for the drug and actually, but the thing really is this: the patient need to go through diagnosis before using medication. But when the patient has no money and you have to possibly give him the option of using the medication that will control his epilepsy. So as a result of that, we came up with the Epilepsy Ambassador of Nigeria. And the essence of that is to try as much as possible to create awareness. So when you create awareness and people get to know about their status, they get to know about what to do when these people have seizure, how to help them, then we can then try as much as possible to reach the government. Most of them actually have challenges managing themselves. So for that reasons, and that was why I was talking about the Epilepsy Foundation. The essence of the Epilepsy Foundation is just like for three functions. One, hope. Two, educate or advocate. Then three, cure. Hope means giving hope to the patient that there is actually a possibility of them living without possibly experiencing seizure all the time. Then educate means the general public need to be educated to learn about what epilepsy is all about. Advocate means you're talking about talking to the government that these people are actually Nigerians, they have a right. They have a right to live. They have a right not to be stigmatized against them. They also have a right to actually have access to medication, even when they don't have money. Because most, that's actually the reason why we talk about advocacy. Then the last one, cure. When we advocate and the government buying into it, possibly a bill is passed, a lot of funds are raised for research in epilepsy. We're hoping in future we'll be talking about cure, not even control.
So let's take a look at societal stigmatization. What's your take on that, and how can this be stopped?
Well, I'll start from possibly when I was a child. I had a sister, possibly a stepsister, who happens to be living with epilepsy. Right now, the whole thing is resolved, so she hardly have any episode again. But then a lot of things when, she sometimes spoon will be put in her mouth whenever she is experiencing the seizure. Sometimes, pepper on her faces. A lot of things, just to make sure that the seizure will ceased. Apart from that, I've seen a situation whereby a patient will have seizure, people will possibly hold the patient tight because they are afraid of the fact that if this thing continue, possibly the child will die. Even sometimes the rate at which people get scared, when someone has seizure, can even make things worse. I've had an experience whereby someone or a lady had a seizure and everybody was rushing. What do we do? And they took the lady's possibly slippers and put it in her mouth, and before you know it, the lady choked to death. I was going in Sele one day and a boy had seizure. Everybody was just fetching water and they were like pouring it on his head. Pour it, don't let him die. Pour it on his face. Pour it. And before, actually, thank God the boy survived it. But what would have happened would have been worse, because the boy too will have choked to death. Because at that particular time, he's not in control of his digestive, he's unconscious. Generally, the people should know what to do when people had a seizure, and they should know how to assist them.
What can be done to assist people living with this disorder, especially during that episode or seizure?
Okay, actually, before answering that questions, I would like to possibly take us back. When someone has seizure, which particular part of the brain is actually affected? Which particular part of the body is actually affected? We're talking about the brain, okay? So most of the time when I go to people and they ask these same questions, I always tell them you use your brain, an acronym your brain. And with that, we have BRAIN. So B means whenever someone is having a seizure, you need to be calm. Okay, you don't need to be afraid. Okay, the seizure will only last for 5 minutes. Okay, if you have to assist the person, you have to be calm yourself, and you have to assure others to be calm that there is no problem. The second one you can do for someone having epilepsy, having a seizure, is remove all dangerous objects. Okay, because there is tendency that the person may likely injure themselves. You know, can hit his head on any hard floor, wood, or anything. So what you do is whenever the person is having a seizure, remove everything that is dangerous in the surrounding of the person. So the third one is A, always time. The essence of timing a seizure is you want to be sure, is it more than 5 minutes? Okay, is the seizure reoccurring after 5 minutes, so that you know when to call for an emergency. Then high, in case the person fall, as in case of generalized tonic-clonic seizure, that is the one every one of us knows, that is the person fell down and is jacking and all those things, because we have more than 40 different types of seizure, but we generally know just about one. When you ask every Nigerian about epilepsy, say, the person fall down and he start possibly jacking and doing other things and the rest, which is just a particular type of seizure. In case the person fall in that kind of seizure, what you do is after the seizure, you turn the person to the recovery position, and in a way that the person will not choke himself. Then you let the person relax and you wait for him as a then the last one, which is in, is what many of us do. Never put anything in their mouth. At the same time, never hold them down when they are having the seizure. When you hold them, it's either you injure yourself or you injure the patient, because it's either you create a muscle tear, because at that particular time it's actually the brain, not the muscle you are holding. Putting spoon in their mouth, eventually you break their teeth, and that has nothing to do with what is wrong with the person. If you can just wait for that 5 minutes, the person will go through the episode and is going to come back. The only thing you need to do is just 4 or 5 steps. Be calm, remove all dangerous objects, time the seizure. In case the person fall down, when the seizure has possibly as the episode of the seizure has ended, put the person in a recovery position. Then even during the seizure, don't put anything whatsoever in the person's mouth, his eyes, or try to hold them. You don't need all those things when the person is having seizure. If you can do that, you are doing the right thing. That is the first aid every epilepsy or every person living with epilepsy that is having seizure need whenever they're having seizure.
Okay, so what are your final thoughts? So what are your final thoughts on managing epilepsy?
Yeah, if you're out there and you now understand what epilepsy is all about, I think you need to be epilepsy smart, and you need to start from today to start to learn about how to help those with epilepsy. We should stop just saying epilepsy treatment or everything has to do with the doctor or just the medical practitioners alone. Everybody can help. There are little things you and I can do to assist those living with epilepsy. You can join some of these advocacy groups, so in order to make their statement heard, so that the government can know there are a lot of people living with it. Like in Nigeria alone, we have almost about 3 million people living with epilepsy. That is actually a number of statistics of some countries in the world. We have some countries that are less than 3 million. So you can imagine. So if there are a number of people as much as they are living with epilepsy in Nigeria, then we should see it as important, and those people too should be taken care of just like every other person. So be seizure smart, learn the first aid of epilepsy. Smart, learn the first aid of epilepsy. You to go out there and tell someone today that epilepsy is not contagious. Okay, go out and convince someone today that the fact that someone is epileptic doesn't mean that the person is not intelligent. Go out there and tell someone today there are epileptic patients, or there are people living with epilepsy which was cut across all disciplines. Some of them are medical doctors, some of them are, in all disciplines. And there's one thing I would actually like to say before the end of the interview per se. There are a lot of people which the consequence of the stigma has actually caused them their life. For example, we had a doctor, the case of a doctor who jumped into the lagoon. He used to have epilepsy, and we were told that some of the job he has to be relieved, and as a result of that, who knows, depression is what follows. So most epileptic patients have sometimes cases of depression, not because they want to have it, but because of you and I perception about them. So to save them, as well as to save ourselves, we need to do what? To learn how to take care of them. Another thing I would like to mention is the fact that if we don't take care of them, we don't give them the hope of them coming out to express themselves and letting people know they are epileptics, some of us too will be in danger. Our drivers, we don't know whether they are epileptics because they will not tell us. Those that are riding the Okada in our road, they will not tell us they are epileptics. At least I knew few of them. They ride Okada and they are epileptics. There was a case that was said by a doctor that he saw an epileptic patient who was having generalized tonic-clonic a day before, and he was in a car being driven, okay, by a driver, and the driver happens to be a public taxi driver, and the driver just looked back and tell the doctor, doctor, have you forgotten you were the one that saw me yesterday? The doctor had to just say, sorry, I forgot something at home. He left the car. But how many of us actually recognize those patients when we see them? It's not written on their faces. You only see it when they have the attack. Okay, our road safety have told us so many times we have accident on our road. They've told us that the causes of accident are bad road. They've told us the causes of accidents are as a result of overspeeding. They've told us about how will I call it, alcohol as well as drug taking. But none of them has given us any statistics in Nigeria for once that there are cases of accident as a result of seizure. And there are. At least if I don't know any, I have. There was one I read in a Punch newspaper as of 2015 that someone who was driving a bus had an epilepsy and drove most of the passengers into a ditch. That was in Nigeria, yeah. So and that means it happens. But our government, how will I call it, agencies as well as officials too should learn about this first aid, and every one of us all together, we can assist those people so that we will be able to assist ourselves too.
Thank you so much, Doctor, for sharing your thought with us on managing epilepsy.
Oh, you're welcome. Thank you very much for having me. Yeah.
All right. Okay, that has been electrophysiologist Mutala Bankole on managing epilepsy and ending the stigmatization. Sound Health continues with trending stories in the health sector and home essentials. Please stay with us. Sound Health this week. Hope you've learned a few things about managing epilepsy. For comments and inquiries, please send SMS on 0818-815-3695 or follow us on social media at LTV Social, #SoundHealth. A sound health is a sound mind. Make healthy living your choice.